benign, long-standing, recurrent and debilitating condition. It is generally characterized by the growth of endometrium-like tissue in places other than the uterus, like the ovaries, the fallopian tubes, the peritoneum, and sometimes involving the bladder and the bowels. It affects around 5 to 10% of the women. Around 25 to 50% of the women with infertility suffer from endometriosis, and around 30 to 50% of endometriosis women are infertile. Clinical presentation. Patients with endometriosis generally present with painful cramps at the time of menstruation, pain at the time of sexual intercourse, back pain, leg pain, sometimes associated with increased frequency, sometimes diarrhea, constipation, and last but not the least, infertility. So how does endometriosis cause infertility? It is suggested that endometriosis causes inflammation and release of certain inflammatory mediators which cause the inhibition of the gametes, which is the sperms and the eggs, and eventually it affects the fertilization. It causes adhesions and scarring and eventually blocks the tubes. Endometriosis also affects the ovary, where it presents with endometriomas. Endometrioma is generally a cyst which is present in the ovary, which contains blood inside it. Endometriomas also hamper ovulation. Investigations. Generally the diagnosis of endometriosis is made by clinical presentation. Endometriomas can be diagnosed on ultrasound, and the confirmation of endometriosis can only be made by laparoscopy. On laparoscopy, endometriosis is graded into stage 1 to stage 4, which is minimal to severe depending on the spread and the involvement of the abdominal structures. Management of endometriosis. The main aim of management of endometriosis is to manage the main symptoms, which is pain and infertility. Management of pain. So the pain management in endometriosis can be divided into medical management and surgical management. Management of pain with endometriosis. Management of pain is generally divided into medical management and surgical management. Medical management is more of a suppressive treatment rather than curative treatment. Recurrence of the symptoms is very common after stopping the medications. It is more of a temporary relief of the symptoms. Surgical treatment is generally recommended in patients with severe involvement of the peritoneum with endometriosis. In surgical management, generally laparoscopic ablation of the endometriotic deposits is done. Also, surgical management is indicated in patients with endometriomas, where the size of endometrioma is more than 3 centimeters. Laparoscopic excision of the endometriomas is generally advised. Infertility and endometriosis. The management base is mainly done based on the age of the patient, the duration of infertility, what is the ovarian reserve, any male factors for infertility, and the involvement of endometriosis. Generally, in young patients with stage 1 or stage 2 of endometriosis, ovulation induction or IUIs can be considered, but the mainstay of treatment in patients with endometriosis and infertility is IVF. Pre-treatment with medical or surgical or combined factors can be considered before IVF treatment.